Hello, my name is Molly Kellgren, Health Science Education Product Manager here at RealityWorks. Thanks for joining me today for a demonstration of our bariatric nursing mannequin. Most mannequins on the market these days represent patients that are thin with low body mass indices. The reality in the world of direct patient care is very different. And unfortunately, many of our students do not get the opportunity to care for bariatric patients until after they get a professional job. Here at RealityWorks, we took this feedback gathered from people who teach in the health science classroom and created our bariatric nursing mannequin. Meet Barry. Barry simulates a male patient of approximately 350 pounds. He actually weighs just over 100 pounds. Barry arrives at your destination in two parts. This makes it easier to transport him in and out of your classroom. He is easy to assemble, but it is a two-person job. As you can see, Barry has the physical attributes we see so often in the obese population. These include a large, apple-shaped torso with a realistic feeling weighted pannus, pendulous breasts, skin folds, edema in the limbs, and typical male genitalia. What you can't see underneath the skin is a skeleton that fully articulates. This means that your students will have a very realistic experience when lifting and transferring Barry, moving him around in bed for linen changes, or when providing range of motion exercises. Barry was created to provide opportunities to practice patient care tasks like eye, ear, and oral care, as well as full body bathing and dressing. With the realistic genitalia, the opportunity to provide perineal care and urinary catheterization is an experience that all students should have before entering professional practice. Navigating the unique challenges related to a large, heavy pannus and a hidden penis can be intimidating to new practitioners. And with Barry, these skills can be practiced over and over in a safe learning environment. The bariatric nursing mannequin also comes with our blood pressure simulator. This allows students to apply a blood pressure cuff and obtain a reading, opening the door for dialogue related to issues like choosing the appropriate size blood pressure cuff, correct placement of that cuff, and blood pressure related conditions that are commonly seen in obese patients. Skin assessment is an important topic for the bariatric population as well. Barry, unfortunately, suffers from a stage 4 pressure injury, eczema, and contact dermatitis. As students learn comprehensive skin assessments for the bariatric patient, they will discover these issues. The RealityWorks curriculum that's included provides 11 to 14 teaching hours to use in your classroom. Thanks for joining me today to meet Barry and to see the different features and functions that he has. If you have any questions or would like to receive more information, please use the information on the screen and we would be happy to help.